Welcome back to another edition of Obesity Week Broadcast News. We're glad you're watching. I'm Sharon Snowden.
And I'm John Holden. We have lots of great information for you as you plan your final days here. And these final days are going to be busy ones.
There still are many activities and exciting sessions to attend.
You'll want to be on hand Thursday morning. It's the second keynote address for this meeting.
Dr. Tom Farley, the Health Commissioner for New York City, will talk about how his city is working to reverse the obesity epidemic.
It is Dr. Farley who developed the innovative and sometimes controversial strategies to fight obesity and create a healthier food environment, including the 16-ounce capping as the maximum size of sugar-sweetened beverages sold at food service establishments.
You'll want to be on hand to hear what he has to say about the success of the programs he has established.
That should be a great session. Now remember, to get full value from this meeting, you must be registered. Registration is your key to a whole range of information and activities, including sessions for both the ASMBS and TOS.
Take time to visit the exhibit hall while you're here. Real learning opportunities exist there as well. Industry partners in the exhibit hall feature the newest and most innovative products, services, and technologies in the area of obesity research, treatment, and prevention.
Of course, the posters selected for display at this meeting can be another learning opportunity for you. Side-by-side poster display areas located in the exhibit hall for TOS and the ASMBS. Many of the investigators will be at their posters during the noon hour to talk with you about their research. And during the noon hour lunch, you'll also be served. It's a part of your registration fee.
Stay with us. There's still much ahead today on Obesity Week Broadcast News,
including previews of Thursday's TOS and ASMBS programs.
Ethicon is a proud platinum sponsor of Obesity Week 2013, featuring a full bariatric portfolio to support you and your patients. We look forward to seeing you in the exhibit hall.
Welcome back to Obesity Week Broadcast News. The American Board of Obesity Medicine is an organization independent from TOS that provides a certification to physicians developing a specialty in either the study or treatment of obesity. While independent from TOS, the value of the certification is clear.
Well, the American Board of Obesity Medicine is a very exciting development in the field of obesity that TOS played a really important role as a catalyst and a support for. The reason this is so important is because with the development of a legitimate specialty in obesity medicine, policymakers take obesity seriously, folks deciding about investment in research take it seriously, and we are constantly evolving as a result of that towards a more evidence-based approach to obesity. The Obesity Society provides outstanding support for people preparing to become certified in obesity medicine through continuing medical education at the annual meeting, through webinars throughout the year, and through practice questions that enable folks to be really well versed when it comes time to take the board exam.
The 2013 certification examination for obesity medicine physicians will be administered in December at computer-based testing centers throughout the United States. When health providers talk with patients about their weight and the options for managing and treating obesity, patients are 3 times more likely to try to lose weight. That is the idea behind a new program called Treat Obesity Seriously. It's a program designed to help patients by equipping healthcare providers with the tools they need to help reverse the obesity epidemic.
Treat Obesity Seriously campaign is a joint collaborative effort between TOS and its Corporate Advisory Council. It is meant to provide tools, knowledge, and resources for primary care providers and policymakers to treat obesity seriously.
You can learn more about Treat Obesity Seriously by visiting the TOS Member Services booth. And that's where you can sign the pledge to show your support and commitment to this campaign. The lifeblood for any organization often lies with the junior members, and that is why TOS takes so seriously the support provided to junior members and young investigators. That support takes the form of many opportunities.
A few years ago, the leadership of TOS made an excellent decision to assure that early career and young investigators are deeply engaged in the work of TOS through its standing committees. And I've seen firsthand on the advocacy committee the vitality, the energy, and the fresh ideas that early career investigators have brought to that committee and really played an important role in our success.
Of course, the support goes far beyond the option for committee membership, especially for young investigators. They will find unique support available to help them find the funding for research.
TOS has taken a very important step in creating an opportunity for senior people in the society with proven track records and success in writing grants to provide a feedback opportunity for the junior people who are maybe submitting their very first grants, an opportunity to provide them with feedback about the organization of what they're writing and the content of what they're writing, designed to improve the quality of the submissions and hopefully the likelihood of funding.
The Obesity Society's Awards and Grants program recognizes specific research achievements and major contributions to the basic science, treatment, and prevention of obesity. Awards and grants highlighting the careers of obesity researchers will be recognized Thursday morning here at Obesity Week. Okay, now you've had time to experience Obesity Week, so take the next step. It's time to share hashtag OW2013 with your friends and family through social media. It's the perfect way to let the world know about the breakthroughs presented during this historic gathering. For more detail, turn to the center pages of your program book. That's where you'll find ideas for joining the discussion on Facebook, Twitter, and Instagram. There's still more ahead on Obesity Week Broadcast News, but first we invite you to watch these messages.
Welcome back to Obesity Week Broadcast News. Always a highlight of the ASMBS meeting is the recognition given to investigators in the field of obesity treatment. We hope you're taking advantage of the opportunities to learn from the papers and posters presented this week. You may be especially interested in attending the sessions presenting the research revealed in the top 10 papers submitted for this meeting. The MBSA QUIP is tasked with accreditation and quality improvement of bariatric surgery programs in the U.S. Earlier this week, some of your colleagues took part in a session designed for surgeons, facility administrators, and integrated health team members who participate in the development and implementation of the bariatric surgery accreditation program in their hospital or practice. That session was designed to continue the excellence for which the specialty has become known.
Well, I think when it comes to quality in bariatric surgery, we're leaders in the field. I think it's become a buzzword all throughout healthcare to have emphasis on quality. The good news for us in ASMBS is that we've been there, done that, and we're going to continue to lead in that direction. We started out with many of our cases being done laparoscopically, and now it's the huge proportion of them. And with that has come a lot of quality improvement. We've seen enormous decreases in mortality. Lives have been saved.
Thanks, Dr. Morton. The importance of the multidisciplinary approach to bariatric surgery is recognized as an important step in maintaining the quality Dr. Morton just talked about. That is one reason the integrated health component of the ASMBS is receiving so much attention. We spoke with Karen Schultz, the president of Integrated Health, about the added value of this approach.
Well, I really think the value of integrated health membership is to keep you connected to the whole world of bariatric surgery. I think that many of us are out in our programs taking care of patients and we kind of feel all alone. And so when you join the integrated health team, it really gives you an opportunity to network with some colleagues and friends and make some connections that really can last your entire career.
How does this approach benefit the patient?
The multidisciplinary approach to care is a way that we can really surround our patients with support all around the time of surgery. The surgery is obviously the most important part of a patient journey, but that pre-operative education, preparation, screening, and then follow-up for a lifetime is really best provided by all of the health professionals that comprise integrated health. So we have the nurses, the psychologists, the dietitians, the advanced practice providers, the program administrators, our exercise physiologists, all working together to provide our patients the best possible journey to their health goals.
Thanks, Karen. It's not only surgeons who benefit from certification. ASMBS recognized the value provided for nurse members of the Integrated Health Team, a pathway to their own certification. William Garash chairs the Integrated Health Certified Bariatric Nurse Certification Committee.
Well, certification differs from licensure, and that licensure is a minimal standard, basically for a nurse to practice nursing. It does not include anything extra, just that you've met the minimal standard, where certification indicates that you've gone and gotten other knowledge and skills way past the minimal standard.
Spend a little time around active members of an integrated health team, and you'll find members dedicated to help the bariatric surgeon and the bariatric patient. And the organization is eager to provide more tools to support its members. Here's Karen Flanders, the chair of the group's Professional Education Committee.
The Clinical Issues and Guidelines Committee is responsible for many of the different issues and projects that concern integrated health in their practice. Some of it includes the evaluations, the nutritional evaluations, the psychological evaluations. It also includes some guidelines that we've developed for gastric band adjustments, sensitivity training, and one of the big projects we have on the back burner right now coming to the forefront is going to be our toolbox that we're developing for metabolic and bariatric surgery programs to help clinical coordinators and all the staff with their programs to develop it into a quality program.
Thanks, Karen. Now, do you have questions or concerns about things that are occurring within the specialty or ASMBS? Do you have questions you'd like to ask the ASMBS leadership? Well, you'll have that opportunity during the ASMBS Town Hall. It's an open forum designed to provide information centered on the challenges facing our field and our society. Priority will be given to questions submitted prior to the meeting, but time permitting, you'll be able to ask your questions too. And we'll be right back after these important messages.
Ethicon is a proud platinum sponsor of Obesity Week 2013, featuring a full bariatric portfolio to support you and your patients. We look forward to seeing you in the exhibit hall.
Ready to party? TOS members are gearing up for their big social event of the meeting.
Always ready. They're celebrating Thursday night at Stats, a unique Atlanta restaurant and club just a 5-minute walk from the Georgia World Congress Center.
Stats is a casual dining experience that offers a unique take on classic American favorites. And it's one of the only bars in the U.S. to feature a tap system, which allows guests to pour their own beers at their table.
This one-of-a-kind venue offers an indoor-outdoor setting for our social event with a roof deck overlooking Atlanta.
You won't want to miss this opportunity to join your colleagues for an evening of socializing and networking. Drinks and snacks will be provided. Tickets are $40 and may be purchased on the registration site.
We sure hope you're enjoying this meeting.
We know you are. And you may already be thinking about plans for 2014.
Plans already underway for Obesity Week next year. We're going to be in Boston.
Plan now to attend Obesity Week 2014, November 2nd to the 7th in Boston, Massachusetts.
That's today's edition of Obesity Week Broadcast News. Thanks for watching.
And remember, ADA Broadcast News is available in more than 2,400 hotel rooms here in Atlanta, as well as on most of the shuttle buses serving the convention.
Have a great day, everyone. We'll see you again soon.